Very good morning to you and welcome to Stopping Medical Tourism. My name is Joseph Kadri, and on today's episode of the program, our focus will be on stroke, tackling stroke, the causes, the prevention, and of course, if you're unfortunate, the treatment. Many say it's caused due to high blood pressure, some say diabetes, some say lifestyle, irregular exercise. Some say it's even an arrow from the village. You find out in the course of this program, and which is why I'll say go nowhere, because we'll also give you an opportunity to call in and ask, questions bothering you about stroke. And of course, to do this is your number one orthopedic consultant orthopedic surgeon, who is also a pastor and of course a philanthropist, Dr. Christopher Otabor. Very good morning to you.
Good morning. Thank you for having. Good morning, viewers.
Okay, Doc. This morning, of course, the issue is stroke. There are so many misconceptions about stroke. What is stroke in medical terms?
Thank you. Stroke is actually the lay language. The real medical term is cerebrovascular accident. Yes, it means that something has happened in the brain, which is now affecting.
It has to do with the brain.
Yes. So stroke is not an arrow from the village, and it's not home trouble. It can be explained medically.
All right.
Yes. When the brain controls the entire body. If I'm able to move my hand, it's because my brain allows me to do that. If I want to initiate a movement to stand up and walk, it's because the higher center, the brain, will allow me. But if something goes wrong with the brain, then it can limit that movement or even stop it. Even our speech, the shape of our face, the muscle actions, everything is controlled from the brain. So usually, stroke involves a disease of the blood vessels in the brain. Just like we have blood vessels everywhere, we also have blood vessels in the brain. These blood vessels, they supply nutrient and oxygen to the brain tissues. And almost 1/3 of the entire oxygen we need in our body is consumed by the brain. The brain is so oxygen dependent. So when the blood vessel either blocks or ruptures at a particular point within the network of blood vessels in the brain, then there's cut off of blood supply to that portion that the blood vessel is supplying. And that is what will manifest in the body. So if it happens on the right side of the body, the left side will be paralyzed. If it happens on the right side of the brain, the left side of the body will be paralyzed. If it happens on the left side of the brain, the right side of the brain will be paralyzed. And there are different. Stroke is a spectrum, depending on where the blood vessel ruptures. Sometimes speech is affected. Sometimes the eyelid will fall. Sometimes the upper limb and lower limb will be paralyzed. Sometimes memory is lost. And in very massive stroke that involves a major blood vessel, many people will die instantly.
So what causes the rupture of the blood vessel?
Okay, yes, thank you. There are a number of factors that causes it. And there are predisposing factors to development of stroke. But in this environment, the two commonest predisposing factors are hypertension, uncontrolled hypertension, and diabetes. What these two diseases do to the blood vessel is that they make them not to be compliant. What do I mean by that? The blood vessels are supposed to be soft and pliable. They are elastic. So when the blood comes with its pressure, the blood vessels expand for it to pass, and then it collapses. It expands per bit. It expands. But with sustained high blood pressure, the blood vessel wall become thickened and become reactive, such that that expansivity of the blood vessel is lost. So with certain pressure, instead of expanding, it cracks. And then with that rupture, then that leads to stroke. Then another factor is it's not just rupture of the blood vessel. Blood clot can form within the blood vessel. Normally, the blood vessel is supposed to be very smooth, you know, and the blood just flows gently through the channel. But if for any reason there's roughness on the wall of the blood vessel, it quickly magnates the cells and then blood clot forms. And once it gets to a critical level, it blocks the lumen, and then that leads to a stroke. So what factors can cause this? Hypertension can also cause it. It can, because sustained high blood pressure can affect the endothelium, the lining of the blood vessels. Apart from that, high cholesterol, you know, that's why we say
that's
do your
lifestyle now.
Yes. When we take a lot of fat, a lot of fried food and all that, then people who are very big, obese, they have a lot of blood fat in their system. So this cholesterol, it goes to stay on the blood vessel, and it can be building up. We call it plaques. It can be building up until it reaches a critical level. It cuts out the blood supply, and then a stroke ensues. What about diabetes? Sustained high blood sugar affects the blood vessels. It can cause the blood vessel to malfunction. It can also cause that roughness within the interior of the blood vessel. And there are many ways. In fact, even blood sugar derangement can also increase the cholesterol, level. So all those can work together to cause a problem with the blood vessels. But also in young children that have sickle cell disease, because stroke is not limited to elderly people. Because actually,
that is the belief.
Actually, the older we get,
from 60.
Yes, the older we get naturally, the older we get, the more our blood vessels become tough naturally, and then there's a higher chance of getting stroke. But with other factors that lead to stroke, like sickle cell disease, you find a young boy of 9, 10 years suffering from stroke because in sickle cell disease, the blood cells are abnormal. There's a tendency for them to clump together, and then that's what leads to crisis. But if it happens in the blood vessels, it will lead to stroke. There are many other factors, hypercoagulability state, sedentary lifestyle, those are predisposing factors. But by and large, in our environment, these 4 factors are mainly responsible for over 80 to 90% of the stroke that we have.
Diabetes,
hypertension, high cholesterol in the blood, and sickle cell disease.
Wow. Now, what are the signs and symptoms? Can we say when someone is diabetes or have high blood pressure, or a sickle cell patient is already at risk of having stroke? Yes,
most of these things when not controlled. But the beautiful thing is that when you control your blood sugar and control the blood pressure, the risk is minimal, like the general public, yes, the general population. The symptoms of stroke, it's difficult for anybody not to know that he has a stroke because it usually gives itself away by the presentation. And that sudden accident often happens in the night, during sleep. Studies have shown that. There's a sudden onset of difficulty in moving some parts of the body, either the right side or the left side. And sometimes the face deviates to one side because one side is paralyzed, so the muscle pulls to the other side. Sometimes one has difficulty in closing that side of the eyes, and somebody might also notice that he's not sweating on the particular side. And then there's wrinkling on the forehead. Sorry, loss of wrinkling on the forehead on that side.
Loss of wrinkling?
Yes. Yes, because the muscle that helps us to wrinkle is controlled also from the brain. The nerve supply is controlled from the brain. So when you try to wrinkle the forehead, half of it would wrinkle, the other half would not wrinkle. So these are some of the symptoms that gives stroke away. Okay, so then,
Okay, now it's the crux of the matter now. For those who, of course, have it, you have family member that have it, you have friends that have it. This is where we need to pay more attention, as we're going to be looking at treatment for stroke.
okay, there's also something that is, people call it the junior stroke. It's called transient ischemic attack. It's not full-blown stroke. You just feel some weakness, and usually it's reversible, but that's a dangerous warning sign. Yes, you feel twitching on the face, you feel weakness, on one side of the body, feel very funny, heaviness somehow, but you are still able to move. Yeah, if that patient needs to be evaluated thoroughly to look at what's causing it. Otherwise, the full-blown stroke can occur. Talking about treatment, the best form of treatment is to prevent it, because many times people are helpless concerning stroke in the medical profession, depending on the extent of the stroke. But that's not to say that people don't recover. There are many people who recover fully from stroke.
As if it never happened before.
Yes, as if it never happened. But the worst type of stroke is a second stroke. So if anybody has had a stroke before, it is the cardiologists. Cardiologists are the people who are specialized in treating stroke. It is the cardiologist's responsibility to remove all the compounding factors, all the predisposing factors, and treat any underlying cause to prevent a second stroke. Because the second stroke is usually bloody, is usually lethal. It can lead to death very often. So the treatment, like I said, you prevent. Then the patient must be admitted in the hospital. And usually the blood pressure, if it's stroke that is caused by high blood pressure, the blood pressure will be hitting the roof. So the blood pressure is gently reduced, in a systematic manner. And then the first thing to do is to do a CT scan of the brain. When you do a CT scan of the brain, it helps you to know whether the stroke is caused by rupture of blood vessel or whether it's caused by blood clot in the blood vessel. And the treatment are completely different. If you have blood clot within the blood vessels, in good centers, you can easily melt the clot, and within the first hour. You give something, there's a medicine you give, it melts the clot, and more often than not, patients will do well as though it didn't happen. But in this environment, there are very few hospitals.
But do we have hospitals here?
Yes, we do.
That can handle
we do, of course. We treat stroke in Alliance Hospital.
Alliance? Do?
Yes, yeah, because of course there's a CT scan there. Any hospital that does not have a CT scan cannot manage stroke, optimally. Because what are you treating? You are just treating blindly. So you must, as the stroke is happening, within the hour, that's why it's good to take the patient to the hospital immediately. If possible, within 20 minutes. And if a CT scan can be done within an hour, and it's looked at, oh, this is a thrombotic stroke, not a hemorrhagic stroke, then the antithrombolysis will start. Thrombolytic agents will be given, and it will just melt the blood clots, and most patients will recover. Yes, but if it's a rupture of the blood vessel, of course, there's not much one can do. But if the blood vessel, if the bleeding in the brain is huge, then there's room for a brain surgery to put a drain to drain out the blood, and then many patients recover. We've treated patients like that before that had brain surgery from stroke. Yes. Then other treatments are supportive treatments. If the patient is not breathing well, you have to support the breathing, put them on life support, treat diabetes if it's the cause. And then, of course, physiotherapy, rehabilitation is as important as any other thing in the treatment of stroke, because you need to continue with physiotherapy to sustain the muscle strength. Otherwise, the muscle will become flaccid, and the joints will contract, and the outcome will be bad.
Terribly bad. Well, that's good news for us here in Nigeria. It means that for those many persons who believe that it is only in abroad that you can get treatment for stroke, hey, what you see
No, the
on,
truth is,
on the screen, you go there, it is treated full blown, and people go there and come out, you know, they come out free of stroke. And this is the point that the line will be open for you to call in and ask us questions. This is the point I call free consultation. You know what I mean.
Let me just make a point. See, this is the reason why our government officials must ensure that our hospitals work and our healthcare is at its best. The reason is because stroke will not give you time to go abroad. If you want to get the optimum outcome from the treatment of stroke.
So it's a treatment that must be done immediately.
You've got to do something within the hour. Otherwise, you lose your best chance of a good outcome. So you don't even have a choice. You have to stay in your locality to treat stroke.
Okay, we have a first caller. Hello, good morning.
Good morning, my name is Chibuzo.
Chibuzo, where are you calling from?
I'm calling from Galikitu.
Okay, quickly, what's your question or comment?
The doctor always listen to us, always. Doctor.
Yes, good morning.
Like I'm so tired when my blood pressure go high. If I go to hospital, they say it's high. And unfortunately, and I find out that it's what can trigger the blood pressure. If I eat food, you didn't digest. If I eat food, you didn't digest. I do scanning, do medical, do blood tests. You know, some hospitals, they don't actually give person drugs. They'll be giving me BP drugs. So later, I now find out it's ulcer. He cannot eat food. He couldn't digest it. And all these days, there's nothing in cough. My back aches. Sometimes it scrambles me up and down. You know.
Yes, stress can cause increase in blood pressure. Whatever it is, the important thing is that the blood pressure must go down, whatever it takes. It's not only drug that is used to treat blood pressure. Lifestyle modification, exercise, diet, and relaxation, all those can help in reducing blood pressure. But by all means, just ensure that your blood pressure is low.
Okay, I hope Chibuzo got that. Hello, good morning. Good. Can you speak up, please?
Good morning, sir.
All right, your name and where you're calling from? Quickly, your question.
Okay, I understand your question. A relative of yours was rushed to the hospital because he couldn't move the hand and the leg. And before they set the line to put blood for him, the patient died. Is that the question?
Yes.
Okay,
so want to know if
you want to know if it's stroke that caused it. I can't know based on the information that you have given. Yes, we need to have more information to be able to know whether it is. But sorry about the loss.
Hello, good morning.
Good morning. Good morning, sir.
Your name and where you're calling from? Okay, quickly, your question.
Sometimes ago,
hello? Okay, we will.
I discovered that I couldn't move one side of my leg, and it was like bone was very cold. The bone inside was very cold, and
okay, doctor.
So when I went to sleep. When I woke up, the matter was very critical. I couldn't walk. I couldn't even do anything. So at some point, I started.
The network on his side is not friendly.
It's shaking, and I don't know when I ask people. Some people say that maybe I have no, like, I don't have much blood in my body, or the blood is.
Okay, whatever it is, if it's bone, if it's stroke, you are just onto the right.
Okay,
doctor.
well, the thing is, let me quickly say that it's not every time someone is not able to move his hands or legs that it is stroke. It could be a muscular thing. It could be a nerve thing. Yes, it could be a paralysis from spinal cord injury. You know, so, and it could be maybe pressure on the nerve. Yeah, maybe the way one slept. Like if you sleep over, you know, and put your hand across an armchair, it can lead to weakness of the hand. Yes, but for stroke, there are classical features that lets you know that this is stroke, and the doctor will be able to.
And so he needs to see a doctor. You need to go to Alliance Hospital to find out what the issue is. Hello, good morning.
Good morning.
Your name and where you're calling from?
My name is Bashir. I'm calling from Dubai.
Okay, Bashuri from Lugbe. Let us hear your question.
Yeah, thank you so much. I love this program this morning.
Thank you.
I'm a smoker. So I remember then when he had this problem, so some part of the body paralyzed. So then along the line, we discovered that he has too much of urination. You understand? And sometimes he behaves somehow. You understand?
Yes.
He behaves somehow. I want to ask this question. Does too much of urination cause this stroke?
Okay.
Or the behaviors of my dad also can cause this stroke also?
Okay, Bashir,
I think you made your point.
Now listen to him.
Yes. The too much of urination might be a sign of diabetes. And diabetes is one of the predisposing factors to the emergence of stroke. So that's one. Then two, there could be another reason why he had a stroke, which is hypertension. And then he might also have at the same time urinary tract infection. Because urinary tract infection is very common in the elderly. And one of the ways that it manifests is that the elderly behaves irrationally and they will look confused, especially in men. So urinary tract infection can manifest as frequency in urination and also confusion. So I think, so a doctor needs to tie all these things together.
So you need to go to Alliance Hospital. Hello, good morning.
Hello, good morning. How are you?
I am fine. Your name and where you are calling from?
I am Ayo. I'm calling from Guanimpa.
Okay, Ayo from Guarimpa. What's your question?
I want to find out when somebody begin to have a headache and a back pain. Is it part of the symptoms that he's talking about?
No. Headache and back pain, they are not the symptoms of stroke. Yes.
Okay, thanks for calling. Mr. Hello.
Hello.
Yes.
Go on.
What I'm saying is that early in the morning my head will be very heavy. What is the responsible to that?
You need to go to a hospital to do some checkup. The doctor will check you and advise.
Thank you, doctor.
So you go to number 5 Malum Faji Close Alliance Hospital.
Okay.
Yeah.
Thank you.
Yeah. Okay. This is the part that most time we cannot take all the calls. But one thing we'll do is that even after the program, we still pick your calls and you can send your messages. We will definitely get it and attend to you. We will reply your message. Even after the program, you can call in. We just have barely 2 minutes to pick your call. Hello, good morning.
Good morning, sir.
Can you move away from your TV set?
Okay, sir.
Yes.
I'm calling from Chati.
From where?
From Chati in Abuja, Darki district.
Okay, quickly, let's hear your question.
Yes, my name is Yakubu. I want to ask, please, this Alliance Hospital, is it a government hospital or a private one?
It's a private hospital.
Please, I want to make a request. If they can bring a branch in that, it will be a help to us.
Okay, to be looked into.
Okay, thank you. I think we have this.
They should get this my number so that they can call. We will be a help to that.
Okay, thank you so much. All right.
It's not a joke to establish.
Yes. Okay. Just one more call and we'll be out of here. Don't forget, if you have any health challenge, you know where to go to. The topic we discussed this morning is key. There are so many factors responsible. All you need to do is to make sure you're not hypertensive and you're not diabetes. Avoid. Hello. Hello. Good morning.
Is reverberating.
Hello.
Good morning, sir.
Morning.
I can.
Good morning.
Your name and where you're calling from. I can hear your name and where you're calling from.
My name is Robert Matkego. I'm calling from Idukari.
What's your question?
My question goes like this. Sometime last year, this problem that you are discussing on this television this morning, it happened to me. And I have nobody to help me that time. I live alone. What I normally experience is in the morning. If I want to get up in the morning, I cannot get up. My left leg will start twisting as if it's a muscle pull. Until I will get up and start lifting the leg. And hit it so before the thing will release a little bit now and get up. I do little exercise and the thing that will release. So it's continuing going on like that. At the time.
What's your question? What's your question now? What's your question?
I drink a lot of water. So before you know it.
What is your question?
I am reducing. So when I went to the hospital, they said I have.
Sorry, when we call, we should just go straight to the point. He's taking about 2 minutes and, blocking other people from calling in. Hello, good morning.
Yeah, good morning.
Please, go straight to the point. What's your question?
My question is that when someone is having stroke, maybe it has gone for 5 years or something like that, what is the main thing that you can do to us that stop the thing?
Well, there's no one thing. It's a combination of factors. Physiotherapy, if you have pain, will give painkillers. Some people use acupuncture. It helps. Yeah.
Okay, many thanks for being a part of the program. This is where we just have to end it. There's no time. That's why most time we say, hey, you, Good Samaritan, come and add to the 30 minutes we have on this program so we can take it, longer. You can imagine if it's an hour, we'll have time to discuss and to take your call. It has been with Dr. Christopher Otabor, a consultant orthopedic surgeon, a pastor, and a first-grade philanthropist. Thanks for coming on the show.
Thank you.
Okay, until we come your way again, a repeat broadcast will be tomorrow, 4:30 p.m. Bye.